Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to this exciting episode. We have a guest with us today, Emma Loftus, which we'll introduce her in a second. How are you going today, Sophie?
Really well. This one's a little way in the making, and it's been wonderful knowing Emma the last few years, so I'm keen for this one.
Yeah, it's definitely an important one. So we're going to be talking about pullbacks and the effects on those. So I've known Emma for a fair while, a pretty long time, and we often have very interesting discussions about lots of things, postural and functional and the world and everything. But Emma, would you like to introduce yourself from this perspective and, what's kind of brought your interest around to the importance of recognizing effects of pullbacks?
Thanks, Raquel and Sophie, for having me on this amazing podcast. I'm super excited. Okay, so my name's Emma Loftus. I'm a registered and qualified biodynamic craniosacral practitioner for humans, and I see horses as well. Probably 90% of my clientele are horses and 10% of their owners. But that's getting bigger. My background was in horse racing, and that's kind of what led me into craniosacral work, because it just made so much sense, like the pressures around their heads and the tightness and the effects on the body, which hopefully we'll all be covering in this podcast. Pullbacks and undiagnosed concussions have been a big interest for me in these last 2, maybe 3 years from a human and horse perspective. And I'm so excited to be here because I think the more we talk about this and get more people just on board on the effects for themselves and their horses, I think the better it will be. And I think my long-term vision would be that we have an assessment and a diagnostic tool with regards to when a horse has had a head injury, pullback or otherwise.
Yeah, that would be pretty cool to be able to recognize the effects of that on them physically, emotionally, and from all aspects, because I think it does have a big impact on their general well-being. So can you just explain, just because some listeners might not understand, what biodynamic craniosacral is? Just a little introduction of that.
A short version.
Shortened version, yeah.
Well, the term biodynamic is really living forces, but it has its origins in osteopathy, and osteopathy has its origins in ancient indigenous healing. And the biodynamic model carries that recognition of ancient indigenous healing, connection to nature, osteopathic principles, anatomy into the present day. It's trauma informed. It really recognizes the whole and not the parts, like not fragmenting the parts. If anyone has heard of craniosacral therapy, it really addresses the head through to the sacrum, and we orient to something called the cranial rhythm. However, I got taken by the biodynamic model because there are deeper organizing forces within the system that are really important, and we can orient the system back to that. That's kind of like the short version of it.
And I guess, would you say there's a big focus on health of that system?
Yes. Thanks for the reminder. It absolutely is. Yeah.
As opposed to, we're often caught up in treating symptoms and the problems, but it really focuses on bringing the system back into its best state of health.
Absolutely. Yeah, it really does draw from Dr. Still's philosophy, which was the role of the practitioner or the physician is to find the health, because anyone can find disease or pathology, you know. And yeah, I was going to say something else, but I've forgotten, so I'll wait for the next question.
Well, I was just going to ask you about, you know, it's quite whole encompassing for the horse. Why do you think that the effects of the pullback are so important? What relevance do they have to you with, you know, craniosacral and
Jumping right in there.
yeah,
I love it. I love it.
straight in.
Well, I wanted to, I think before I answer that, I wanted to say, because obviously people like, what does craniosacral therapy look like? Not much, you know, to the naked eye watching. It is a very light touch. Manual being a hands-on therapy, so the hands are on the structure, but the manipulative techniques are no longer there because it's literally through touch and knowing the anatomy and listening to the body and it then being able to self-regulate. So to answer Sophie's question, a bit of my background was really in working in environmental sector and ecology and, you know, climate change. I was really into that for a number of years. And I could really see for me in my studies of this work that, you know, obviously the body is very much an ecosystem, that what we see in nature around us is reflected in the body and vice versa. And, you know, when you see a free-flowing river then becoming blocked, over time, there'll be degradation to the surrounding environment. And you'll start to see different ecosystems appear that might not be supportive of the system that was once there. And if, for example, the blockages from the river are restored, that free-flowing health of the river then is able to assist the surrounding environment and health is restored to that particular ecosystem. So for me, that's when I'm trying to explain the importance of taking note of a pullback injury. That's what I will explain. So it's not just about the horse putting a huge amount of pressure on their head, it's what's happening underneath to the important lymphatic, vascular, cerebral spinal fluid structures. And what are the knock-on effects to the whole system?
Yeah, cool. Which some can be seen and some
Yes.
not so easily seen. And I guess that's the ones that aren't seen that are more difficult for people to appreciate. But could you kind of explain the ones that people can see and the importance of or the kind of underlying anatomy that's affected with, you know, what we can see externally, so people can kind of recognize it from an external perspective?
Yeah, for sure. And I know you guys will have input on this because you're both, you know, body workers, and, you know, so you'll know when you come across a horse that's tight up there in the head and neck. So first of all, for anyone that doesn't know what a pullback might be, that is when the horse may be tied up and gets a fright and pulls back. Now, there are various methods of tying up a horse. A lot of people are aware there are good ways and not so good ways. These can be done in early training. These can be done just in regular, you know, life, just from what the person may just know what to do with the horse. And it can also just be a freak accident, okay, and just very unlucky. The horse can pull back in a float. The horse may pull back in cross ties. The horse may pull back. Now, what happens, I just want to start here, I think, is really this idea of neuroception and nociception. So neuroception is a sense of safety in your surrounding environment. Now, if anyone's had a panic attack, if you don't feel safe, you need to get out of there, and nothing is going to stop you, or someone telling you to calm down is not going to make it easier.
Makes it worse sometimes because you feel invalidated.
Yeah. Yeah. You're like, I've got to get out. You know. So this sudden panic takes the system into fight flight. And so the horse might, if they're tied up and they can't get away and they just need to get out of there, they're going to do whatever they need to do, even if it means breaking their neck, you know, and it can be pretty nasty. if they're lucky and wherever they're tied to breaks, there'll still be some severe pain there. And so what happens is we get that fight flight going straight to the amygdala, and it becomes subcortical in response, you know, and it's really about survival. And that's where we can get, you know, a pullback where, say, the horse is just pulled straight back. Let's say the string broke and we've got pressure on directly on the pole, which then has a downward vector to the jaw, to the temporals. Then you can have a pullback where they might whiplash their head left and right as they're trying to get away and they're freaking out. And then we have, you know, torsion effects to the upper cervicals all the way down the neck. You could have severe where they pull back, flip over, land on their sacrum, flip over on their back. It can be really severe if, say, is it rectus capitis ventralis, that deep muscle underneath the C2 that attaches to the tubercles of the basi-occiput, if that ruptures, the prognosis is pretty poor. I've heard of horses, you know, they pull back and they might take the fence or whatever they're tied to with them, and then we've got big problems. So not only is the pullback severe, the panic that gets set in the body is there as well. And now we have a huge traumatic kind of inflammatory response, not around being tied up, but also that just can't be resolved. So, you know, often we're looking at force vectors. So there's kinematic forces acting on somewhere that is stationary, where the horse may be tied up, wherever it might be. And those force vectors can get trapped in the body. Some may dissipate into the surrounding environment, but let's say the horse is 500 kilos, the acting kinematic forces might be 1.5 tons.
Right.
So, and it is akin to a whiplash. So if you're driving a car and your body gets whipped back and forth, that is very similar. Okay, so I can go on, but if you have any other questions on that.
I actually was just thinking then about even with these great big forces, like how detrimental they are traumatic wise in terms of, you know, genuine trauma to the tissues. But I know we've talked before about the small things that add up over time, the way people lead their horses, like pulling on the head and neck. If you have a horse who likes to stop and then you pull on their head repetitively, you're compounding this constant brace and tension through those structures as well. You're going to have that sort of like just a compounding effect over time. I suppose you'd see that as well coming through.
Yeah, when there's tension already in the head and neck, there may be just a disconnect even in being led for the horse. And I'm often, you know, maybe asking owners to perhaps like come forward first. And the Tellington touch method of, you know, like feeding the rope is beautiful, you know, and really walking with the horse and maybe waiting until they would like to take a step, which I believe you guys teach as well, you know. But yeah, don't just turn them like you would turn a bike wheel, because there's a whole like living structure attached. And you know, that can just be, and it's just to be really compassionate to the person at the end of the rope who might just be like, oh, you want me to lead them? I'm like, wait a minute, let's just everyone have a look at what's there. It would be like someone grabbing your neck and pulling. But you know, when you get that whiplash effect, I probably should go into a bit of the anatomy so you can see what's going on, right?
Yeah, absolutely. Go for it.
So like the early osteopaths looked at cranial bone motion, let's say William Sutherland. So the bones of the skull and of the whole body do move very slightly, and the bones of the skull and the cranial base are all interconnected with sutures, which are like these beautiful crisscross amazing like network of cysts that are fully integrated with fascia and blood vessels and nerves. And so when there's excessive forces on those sutures, they'll stop moving, and they are designed to move very slightly to absorb impact. But obviously when the body of everything that's on this planet was designed, it wasn't designed with the idea of the conditions that we put on the animals and ourselves in mind, that we were going to drive cars and crash into each other, or tie horses to solid objects, you know, or yank them around by their heads. So that's when it can become detrimental. So when there's excessive pressure on the head and the neck of the horse, underneath the, like behind the poll, the occiput and the first cervical vertebrae, we've got suboccipital muscles. We obviously have the nuchal ligament, and then we have those suboccipital muscles have deep fascial connections to the dura of the spinal cord, which is coming out of the back of the occiput, and it's attached, you know, it's part of the brain, which is obviously within the cranial cavity underneath the parietals. And there's dural connections that divide the brain, and they also support the temporal parts of the brain, and they are continuous inside the face of the horse into the periosteum of the inside of the skull. That periosteum weaves through the sutures and comes out on top of the face, and then you've got the hair. So, and if we go backwards, so if we go to the back of the brain outside the foramen magnum, so we're at the back of the occiput, that is the spinal cord that then goes all the way down in horses to the first sacral segment. And then it becomes the cauda equina, which is the horse's tail, amazingly. And in us, it goes down to about L2, I think. So it's much shorter. So we have like the filum terminale and the cauda equina. And that's like the nerves just go down. So surrounding that spinal cord and supporting it is cerebral spinal fluid. Really important stuff. Probably one of my favorite things in craniosacral work. And supporting that, we've got 3 layers of dura, and the dura is really important. So we have the thinnest layer, which is called the pia mater, meaning the delicate mother, which is like cling film or cellophane surrounding, like deep around the spinal cord. Then interweaving that is the arachnoid mater, which is like the spider-like mother. And then we have the dura mater, which is around the outside, called the tough mother. And in between that is cerebral spinal fluid. So this bathes the brain and spinal cord, keeps it afloat, keeps it at net zero volume, keeps it at zero gravity. That stuff is really important. Now, if you have a severe whiplash, that fluid gets whipped back and forth, and those 3 dural layers get locked down onto the spinal cord. So it's like putting the brakes and the accelerator on at the same time. So it's kind of a real whipping mechanism. And if you torsion it, if you fall over, if you're yanking, like I said, pulling on the horse's head with that halter, because I guess with your experience in foal, Sophie, if you apply pressure, what's the first thing the foal's going to do?
They just try and pull the head away.
Yeah.
Yeah, absolutely. You know, just with regards to what you said before about horses that will break away at any means necessary and flip over. In Stashak's lameness book, in the topic on the hip, it says that many young horses develop injuries to the femur at the end, like just above the hip joint, when they are doing initial weaning training, or being taught to lead, not broken in, being taught to lead. So weanlings, weaners, foals, and that largely comes from the moment that they decide, I really need to take my head back because someone hasn't shown me how to gently come forward into pressure, and they flip over, and that's where they land on their bum. Yeah, I've seen it in person, touch every bit of wood around me. I haven't had it happen to me yet, but they're so flighty and so fractious, and they go over so easily. And I've actually seen a horse that knocked the top of, actually, I saw it after it happened, but it literally knocked the top of its head on the ground. It had gone over so hard, and its withers, you know, it's such a huge flip and such a strong response when they're being taught to lead, you know. It's terrifying to be led around by your head or have somebody grab your head and neck and hold on.
Yeah.
That's panic inducing.
You go to turn and look or orient, You can't,
Yeah.
because there's now pressure. And
Yeah.
I think that's where that panic can set in a pullback. You're frightened, and then you're like, I need to look, and I can't. And now I'm freaking out because I cannot look and I cannot get away. Forget about trying to come back. You know?
Absolutely.
Yeah.
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 It's like the head equivalent of sticking your leg in a bear trap, isn't it?
Yeah.
Like,
Can't get away. Lost my leg.
no. Yeah. What am I going to do? I'm going to try and rip my leg out before whatever set this trap is coming to get me.
That really wasn't where I thought you'd go, the bear trap, but that's now
Oh.
freaked me out.
Yeah. But I really, yeah, I do think that. I'm like, God, it's so panic inducing.
Yeah, it really is. And that we're looking at concussions. For me, you know, a pullback is a whiplash, that is concussive forces. And that's where we get real problems. And, you know, those membranes in the skull, they're known as reciprocal. So they're always in tension, and they're designed to breathe and move in a certain way. And if there's torsional forces or impacts, those will not, the body will then adapt. However, it's not sustainable because those forces can then not move as they're supposed to. So if there's tension on the upper neck, we might then have opposing forces on the lower neck, and then on the spine all the way down to the sacrum. You know, and I think that's where, you know, we've got those deep supporting ligaments that around the vertebral column that, you know, I'd be keen actually to look more, I think, in dissection around their role. You know, we have obviously the dorsal ligament and the ventral ligament. They don't seem to be, from the research I've just recently read, that to be so, like I think the ventral ligament in the horse seems to be starting around T5 or T6, but I'm curious as to why the whole cervical column, it doesn't seem to be supported. I know we have the lamellar part of the nuchal ligament, and obviously the supraspinous going further back. Do you know, Raquel?
Oh, I wonder if that's just a pure range of motion, you know, like that they have so much motion through their neck. And generally, when there's increased ligamentous structures around a joint, they're usually to control the motion of a joint, like within a certain plane. So like you look at like the carpus, it's so ligamentous because it only flexes and extends. So it's like really controlling it within its motion, whereas the neck has such a wide range of motion that you can't really, like if it had, say, ligaments on the lateral aspect or underneath, it would change the range of motion. Whereas like you look at the thoracic spine and it's much more stable relative to the neck, and it needs to be much more stable. Like it just doesn't need, they don't need to have as much motion in that when they put their head down or when they put up. It actually needs to be stable to support the connection to the forelimbs and transmit the forces through to allow for motion. So that would be my thought process around it.
That does make sense.
I wanted to say with the ventral ligaments, because and I know you're going to talk about how they become, you know, affected in the pullback. You've kind of mentioned it, but I've seen horses, I've seen bones that have changes where the ligaments, especially that ventral ligament, attaches. And so, you know, when we image, we can only look dorsally. So we can only look at like the spines of the vertebrae and assess for things like kissing spine. But say you have a pullback injury, and I never really thought of it coming from here, but if you have a pullback injury that's influenced specifically those ventral ligaments, because they're probably under the most strain because a lot of spines are not supported well into extension, then I've seen bony change under there, and quite prolific to the point of some where they were actually fusing or trying to fuse on that ventral aspect. And it's just such a difficult area because we cannot image it. Like without putting the horse in a full body CT or MRI, like we can't assess for damage in those ligamentous structures. And I've seen damage in ligamentous structures on, like, say, the carpus, for example, where at the time, unless we had an MRI of the carpus, there was no nothing that could be found, like nothing on ultrasound, nothing on x-ray, but then the carpus degenerated over time and showed, well, there was an injury. It did affect it, but it took maybe 6 months or a year to show up in the bones.
Yeah.
But the ligamentous injury was there. So I guess that's where, you know, you're talking about these really deep structures, which maybe at the time, you know, you can feel it, you can put your hands on, you can feel that the damage in the system, you know, I can feel it to some degree. But for the person who has the horse, there's no evidence of that at that point. It might be a couple of years down the track at which the evidence becomes clear to them, where they start not being able to use their spine appropriately, or, you know, some other effect, or they get neck arthritis and you just go, oh, well, like that's just bad luck, isn't it? But perhaps that pullback or number of pullbacks were actually the thing that set that up from a ligamentous dural
Correct.
deep perspective.
You've just raised a fantastic point, you know, which is really what we want to talk about in this is, you know, going back to being the detective, for example, and looking at like getting that history. What's the history, you know? And Sophie gets to see it from the very beginning and trying to implement the best practice. But what you've just spoken to there is actually what I was going to just talk about, which is, you know, what's going on that we don't know. So visually, you know, I mean, thanks to, I think, to a lot of the talks that say my colleague Shay and I have done last year on pullbacks, I get more horse owners going, my horse has had a pullback, can you come out? They can see, you can, what might be the things that you might see immediately is a very tense posture where the head is up and the cervical spine is almost hypertrophied around like 4, 5, 6, maybe. They're very sensitive to touch. They don't really want their pole touched at all. They're tight through their withers. They're very reactive. The nervous system is cooked. They seem to be very jumpy. They seem to have trouble turning one way, perhaps the other way, you know, and yeah, so all of that can be something that can be visually seen. And sometimes I will have owners and go, I don't know the history of this horse. However, it's been, I've had to like take the bridle off apart to put it on. They're very tight around their pole, all those kind of things. So what could be going on underneath? I mean, let's look at trying to turn the head and neck. That can be anything from the bone that forms the rear socket of the eyes being pulled through these force vectors, affecting the cranial nerves that innervate the eye. There will be tension through, you know, that the cranial nerves basically out of the upper neck and all the way down, affecting the nerve that innervates the trapezius. I don't know if you want me to go through those cranial nerves, or I don't.
I think that it's more important to kind of, well, just how what people are going to see and how they can recognize it, and the kind of practical functional aspects of it.
Yeah, so if we go back to say the immediate downward force vector on a pullback, that's putting immediate pressure on that spinal cord and on all of those bones that are supposed to breathe and move in the face. Okay, and there are a bunch of cranial nerves, just like we've got 12 pairs, and 4 of them are specifically for eye movement. The trigeminal goes through the eye, parts of the vagus go through there, and so one or 2 in particular, one called the trochlea and the abducent, are for abducent meaning looking away, and the trochlea is for moving up. Okay, and down. Now, sometimes you might be able to see, you guys, when you're with horses, that when they go to turn their head, they'll tilt their face to look, okay, because they actually can't turn their eye. And that can be from some head pressure, some head trauma, maybe a pullback. That will also affect the neck as well, because the eyes and the neck are so interconnected in their proprioceptive, you know, conversations that they have. And another cranial nerve exits out of the back of the skull with the vagus, and the nerve that talks to the tongue, and that's the accessory, and that talks to the neck muscles of the trapezius. Severe pullbacks injuries, I've seen loss of motor control to the tongue. There's a 12th cranial nerve that comes out of the back of the occiput toward the hypoglossal, if that gets impinged. So really, it's not so much like the nerve getting squeezed so bad, it's the fascia around the nerves that really start to cause problems. There's an osteopath called Roland Becker, who's passed away now, but he talks about whiplash in humans as acute cervical syndrome. So, you know, your horse has had a pullback, there's no radiographic evidence of fracture, trauma, anything like that, but there's pain that won't go away, and it's going on weeks and weeks afterwards. We're looking at fascial dysfunction, autonomic nervous system dysregulation. You know, we've got how many ganglia? There's 23 pairs of ganglia in the cervical region alone, that, you know, where we've got nerves talking to other nerves.
Can you just define ganglia?
I can try. So they're like little stations where there's relaying information coming from the core nervous system, and some of those ganglia might talk to viscera, some of them might talk to cranial nerves. So we've got the core nervous system of the brain, spinal cord. The peripheral is, you know, the nerves exiting out of the spinal cord. Apart from the ones that do smell and vision, so optic and olfactory are very different to the rest of the nerves because they are direct invaginations of the brain. The olfactory does not interface with the thalamus. So the thalamus is deep within the brain. The cranial nerves go back there and go, hey, this has happened. And then so the brain goes, okay, and, you know, sends back. Now that should all be working just fine. But if you have these deep force vectors happening, we get dysregulation. Everything starts to stay in a very sympathetic state, a very stuck state. What could the long-term effects be? And that's where I wanted to go with what you were saying, Raquel, around degeneration, posture. Like, the work you do is so important. Improving posture will improve vascular flow. So unseen effects to head trauma and pullback, excessive long-term pressure on the head will be fluid flow disruption. And there's that river I was talking about at the beginning. Now, after a while, that surrounding structures just aren't getting the things they need. There's vascular,
not getting the nutrients that they need.
That's right. So, yeah, there's a venous supply in the brain, and there's a vascular supply in those membranous structures that divide the brain and support the brain. There's also lymphatics through there. There's cerebral spinal fluid, and of course the powerful fascial deep matrix, which is very similar in its consistency to cerebral spinal fluid. So, you know, when that starts to not be able to drain properly out of the head, so if we look at that downward force pressure on the back of the head, right underneath, if you look to where the horse's ears are and kind of go inwards, there's a deep structure called the jugular foramen and the foramen lacerum. Out of there, we've got the jugular veins, and the foramen lacerum has the emissary veins. And we also have the, so that's all like vascular supply from the brain, like draining. And then we have three pretty cool cranial nerves, the vagus, I think everyone's probably heard of that one, and the accessory that turns the neck, and the glossopharyngeal that's to do with saliva swallowing, all that kind of thing. So when that starts to get congested, I know that there is evidence in human MRIs of a asymptomatic mild concussion and a test subject where they MRI'd the test subject. We've got the deep internal carotids coming out of the back of the skull. You can see them clearly, like two long tubes. And then on the person who had mild concussion, asymptomatic, you couldn't see them 6 months later.
Yeah, wow.
So what do we start to see? If that's not really happening, that blood supply starts to get restricted. Then we got force vectors down the neck, through the spine. What's feeding the spine? We've got the thoracic aorta going through there. That and is it the radicular arteries that feeds into the spinal cord? It feeds the ligaments. So when and this is, something I just heard very recently, we have something called silent degeneration happening. So the reduction in fluid flow, we might not see it straight away, but just as you said, Raquel, like 2 years later, oh, got disc degeneration and we've got arthritis in the lower neck. But how long has there not been adequate blood supply to that area? That is, we're now seeing this, and now it's too late. And that's osteopathy. That's clearing those rivers, isn't it? Yeah. So I can get really passionate about this.
So then, if a horse has had a pullback, so we've talked about kind of some of the physical things that you might see and some of the deeper effects that it could have. What kind of behavioral aspects might you see in a horse that's being affected due to like the silent inflammation or degeneration that's been occurring, in response to, like, we're obviously talking specifically about pullbacks, but how can it maybe translate over into their behavior, which might be mistaken for bad behavior?
Yeah, I mean, the behavior could be anything from just not wanting to tie up at all, being haltered, bridled. On that, we'll talk about rope halters and other methods of tying up. The kind of very reactive behavior can come around. Not being able to orient properly when there's that much tension around the head and neck for a horse, that's really important.
When you say not being able to orient properly, what do you see in a horse that's not able to orient properly?
They can't turn their head and neck as well. Or they're really not able to downregulate because all of those sympathetics are still on from that tension around the head and the neck, those downward forces. Now, they're affecting the jaw, the TMJ, I haven't even covered that yet, the hyoid. We've got the vagus nerve talks to the hyoid. That's very much a parasympathetic branch, cranial branch, about swallowing, orienting, so the eyes. But the TMJ function starts to get a lot of tension. The masseter gets really tight. We could be looking at stuff like choke. We could be looking at, and again, this is just clinical practice. Okay, I'm not saying this is hard and fast. It's where I would be looking. Is there
maybe a horse that's kind of having a number of episodes of choke or something like that? Then you can consider just the function around that area. That's it.
It affects something. What we're calling dentistry, in human dentistry, the stomatognathtic system, which is all the chewing and swallowing muscles all the way down to the front ribs, the shoulder, and the diaphragm. We haven't even talked about the diaphragm. There could be breathing issues, swallowing issues, just basic not being able to regulate that well. Now, over time, like the horse will just perhaps carry on as best they can, but then we've got those underlying things that the fluid flow disruption can start to bring up. Inflammation is in the body now. It cannot escape. It's got nowhere to go. So we have inflammatory responses. And I think that's where I started to question, if your horse has laminitis, for example, is it the grass, or is that just a tipping point? Has there been a head trauma? If your horse is being diagnosed with Cushing's, is it true Cushing's, or do we have downward forces affecting those deep neuroendocrine structures where the pituitary sits in a little trampoline, like directly below the thalamus, like the brain, the core brain.
And there's so many things that affect that area, right? Like, we're just talking about pullbacks, but obviously you've got other effects of bridles, bits, reins, people's hands, even just the way they hold their posture, especially in riding, because then you've got the other forces coming through the head and the mouth from those aspects, as well as having a pullback injury. But in terms of kind of those metabolic / inflammatory diseases, like, there could have been many layers that have like added up to creating all the restrictions in that area. And we did a
Yeah.
podcast earlier and we were talking about the effect of like the body on on foot pain, and how, you know, we always think that when they've got foot pain that it's foot related, but we were having a discussion about like it could be, yeah, because of a dysfunction elsewhere in the body, and it's the fascial transmission that's leading to the hoof discomfort. But they could have a thoracic sling dysfunction, or a hind end dysfunction, or a hyoid dysfunction, or a pullback trauma that's like changed the tension through the whole fascial system and then ended up showing up as foot pain. But that's where we have to really look at the horse so holistically.
So true. Like because I always, when I see people and they're coming in, I've got a shoulder problem, that's because their brain's saying the pain's now here, but actually it might be T11. Okay. And it actually might be the upper neck that wants the session to start with. So, you know, and with horses, like you said, it's really, okay, you can get as much history as possible, but also through observation and seeing what's going on. A couple of, like, one equine case study I had was, well, I saw him probably 3 times. He'd gone to a rehab place because he had laminitis in his back legs. And where I'm like, really, that's interesting. And really a huge loss of arterial supply to his hind end. And he was in a lot of trouble. And he was a head shaker who I hadn't seen before. And I've gone to this place to see the horse. And I said, has he had head trauma? Because I'm seeing, you know, there's stuff going on there. And the owner was like, no, I don't remember any. And then she suddenly remembered that when he was weaned, he literally lost it and did his head, you know, it really hurt his head in the stable, I think. So that was 15 years ago.
Yeah.
And he'd gotten to the point where the vascular flow had been so disrupted, where and this is probably going sort of way out of where we might go with this talk, but where the structure of the thoracic aorta and its sub-branches that feed the gut had lost their integrity. So he had a huge strong gall infection from that. And that was affecting the abdominal and it was causing inflammation. So anyway, some craniosacral and dealing with the strong gall and some foot rehab, and he's now back and he's absolutely fine. But it's kind of like, that was 15 years. And he was really probably not going to make it at that point. And a human perspective was just the other day, I saw someone who had was going for constant cortisone injections into her spine, and had a diagnosis, I can't remember, but it sounded very inflammatory. And I was asking her about her history, and when I was on her vertebral column, I said, something's happened here. Have you had a fall? Have you had a whiplash? And she said, yeah, when I was 14, I had a water skiing accident. And now she's in her 40s. So, you know, it's kind of going to that point, and seeing I saw a 10-year-old boy a while ago who has had a case history. There's enormous bile on him, and now they're looking at Crohn's as a possible problem, when actually I asked, did he have some head injuries? Yes, serious head injuries when he was a baby. So again, it's same with the foals. Like, I cannot overstate the importance and the severity of even the mild concussion. It really needs to be taken seriously.
Yeah, I'm laughing because I've had multiple.
So have I. I've had about 8 concussions, and if I hadn't been seen by cranial osteopaths, I would not be sitting here now. My mother passed away from Alzheimer's. I have a huge interest in the loss of cerebral spinal fluid production from head trauma alone. It's 70% reduced in Alzheimer's patients. So when that can't be refreshed and renewed because of the vascular and the fluid flow disruption from a head trauma, we're in trouble. You know,
Yeah, it's really yeah, it really just reiterates the importance of not of fixing the problem so that there's not continuous pullbacks. Like obviously there's trauma that we can't control
Yeah,
many times.
absolutely.
Like, even with my young horse Ellie, unfortunately she's had a number of incidences which were both on the lead rope with me. And she had a couple of more mild pullbacks, but they've happened. And I knew when they happened, I was just like, bloody hell, that's changed her system. And now you've got me thinking, because she had like a big tantrum this morning, and I'm like, okay, the tantrum is her personality, whatever. But a few months ago, she flipped. She reared, and I lost her, and she flipped. And
Yeah.
so I was like, hang on a second. Okay, her behavior is not okay, and it's her personality, whatever. But I'm like, I think there's a lot more restrictions there that's kind of making her a little bit more adamant in her behavior. Like we learnt it when I did craniosacral, we kind of learnt it as a temporal tantrum.
Yeah.
And so all of a sudden this morning I was like, oh, I need to do more head work on her. And that maybe that's where the underlying issues are with her, because she has had that major one, but she's had other little ones along the way as well. Plus, she had a head injury when, as a foal, she ran into a wire and coat hanged herself. So that was like number one. So, she's 5, she's not started, and she's already had a number of head injuries, but she's becoming a little bit difficult to manage. And now I'm just starting to think, okay, is that all of these head injuries adding up to her behavior? So anyway, back to the drawing board with that one.
Well, it really is looking at how is the autonomic nervous system functioning. If you think about that locking down on the spinal cord, just if that's the one thing anyone remembers from a pullback, you got me thinking about what we wanted to chat a little bit around, say the young horses that Sophie is teaching how to like tick the adulting box in the horse world. From dissections, right, there's a lot of bones are still in their early stages and not suturally meeting until about 1.5, 2 years old. And there are
the
practices
bones are
out
just
there.
so soft. Like I dissected a foal last week and the bones were just so soft. Like it was a month old, but I was slicing through the bones because they were just so amazingly soft. And people think that it's a tie up that creates a pullback, but really just them fighting with us is enough, especially in a foal. And so, if we talk about things to avoid, and Sophie can contribute here with her foal training knowledge, but like what things would you say we need to be, how do we do better?
Let's leave it a good message. Sophie?
Well, we were asking you, Mel, like what do you
me.
And then I had a few tips that I always I want to like jam into conversation. But what would your, like, if you were talking to people about improvements they can make in their handling, setting up their young horses, understanding, how to do better, what would be the main messages based on what you've seen and what you've learned?
Well, I have to freely admit my knowledge around like working with young horses is still nowhere near where you guys are. I wish I could. I personally wish that more people would get their young horses seen, because if you can get it then all the better. There are practices out there where young horses are learnt to back off pressure by they're wandering around in a field with halters and a rope on. I don't think that's a great idea personally. I think using soft halters with a wide base around the top of the head is gonna certainly, if you're teaching them to come forward or walk with you, if they pull back, the force loading will be more dissipated. Rope halters, I am not a fan of at all. I do, if I have seen a horse that's had a serious pullback, I will just basically say, please get a soft halter for any form of tying up. Okay, because there's also what else is associated with that. They've had trauma in these delicate areas at the back of their ears and at the back of their head. Any pressure there is going to be pretty scary. Sophie, do you, when you're teaching your foals, like, again, to be with the human and obviously learn how that, you know, the human's going to be there and we need to move together, do you use just the is it like a harness thing, or are you actually obviously teaching them a little bit around halter work? How does it work?
No, they're always a lot bigger. So it goes through the full system. I usually, unless I'm going to someone aside from like a bigger contract on a stud, I normally work on 10 days, and over 10 days, it's first touch, putting the halter on and rope around the neck, teaching them to pick up all 4 feet, lead in every direction, and be okay with, you know, being touched with a flag and having a towel on them. And then on the 11th day, they get their feet done.
Yeah,
so it's pretty condensed in terms of those things, but it's definitely when you say a harness, did you mean one of those foal harnesses that goes around their chest?
Yeah.
So there, I would use one of those if they were very young, but I'm seeing them from about 3 months until 8 or 9.
Fitting around the yard.
A bit bigger. Oh God. And these, so they're predominantly thoroughbreds.
Yeah,
that
right.
I see, unless it's stock, like I see stock horses and quarter horses, but a lot less of them. There are some that are so big, their wither is at my collarbone. I'll have to send you a picture. They're massive, but my tips for teaching them to lead, no matter where you're starting at, is actually to teach them to lead off a rope around their neck. And so that's the very first thing I do, because it doesn't create panic with them not being able to turn and look at something they want. It just means that you can actually create a vibration on the rope in a direction, and they can turn and get used to following your hand. So I'd have a loop going around their neck, coming to my hand, and try and keep it on the upper cervicals. And it's just a gesture, like a vibration of the rope and a gesture to get them to turn to you. And what it does is, one, it creates a neural pathway. So the stronger a pathway is, the more likely your brain is to follow that particular pathway. It becomes like a highway as opposed to a back road, country road with potholes. And so when you put a halter on, one, I would tell people to habituate the halter for a couple of days. So the halter should be somewhat neutral before you start asking them to distinguish between types of pressure that it's giving. If you expect too much, you'll set yourself up for frustration, and that's when they flip, panic or frustration. And then I would say, when you begin to teach that turning, you've already created a visual of your hand going to the side. So, and I would always do this in an enclosed space with a rope that is longer than the furthest they can get away from you. I think firstly, people try and, they'll go into a round yard, put a halter on. The foal ducks behind the mare. One, the mare gets a panic when the foal's rope is looped around her bum. And also, that's a real panic for some mares. Also, the foal can get away from you very quickly on a Speedy Gonzales fashion, and they hit the end of the rope, and that's when bad things can happen. And so I would always have be in a smaller space, than how far, with a rope longer than how far they can get away from you. And when you start asking them to move from side to side, when you have a visual with your hand to gently vibrate the rope in a direction, they'll turn their nose to greet your hand, and it just becomes automatic. It's automatic. And so it feels good to lean into that nice vibration. I think that people teaching foal handling should have done a Tellington Touch leading course, because that's my holy grail in the way of like introducing a nice feel. Sinead McCann does those from Boy and Equine Health around Canberra. And she's very good at it. And I just think that once you can get them to come to a feel, you can just get them to come forward by basically getting their attention and rewarding their attention, and they'll come forward to you. And you can just link up the two within, takes a session to teach. And the other reason that I like to do that without driving, this is my personal opinion, I know a lot of people drive to teach to lead, is that when you gesture a horse forward, say you stand at their shoulder and you ask them to walk forward and you drive them with a flag, they will look back to the flag as they walk forward. So they're not thinking in the direction of movement, they're thinking behind them. And it's also a fear response, because you don't move away from something neutral or something that feels nice. And when foals are interested in something, they turn around and look at it. So you are basically guaranteed that you're getting some sort of worried response, and that's why they're moving forward. So I just think that teaching them by directing their focus and making it feel nice and creating a space, this is the most important thing, I think, is to not have a terrible response first, because it's formative. And when you have those very formative memories, they create little dendritic pathways, and those really scary emotional ones, they understand now they don't recede. So sometimes you can have explosions from horses, and it's a spontaneous reemergence of a pathway that only had to happen a couple of times. And I'm now getting on my soapbox, but they would be my tips is to start with a rope around the neck, not with the halter. I think that would be, a good way to not
respond to pressure before we put it on their head.
Yeah,
I love that. Can I just say a couple of things came up from what Sophie was saying, and that is the importance of that orienting reflex. That I know that there are some like methods of teaching out there where, if the horse needs to be with you all the time, whether young or old, and certainly as a practitioner, when I come up and the horse says hi and they're checking my camera out, they're checking my clipboard, and then they get pulled away, and I'm like, no, please let them check this out. Or if they look away in a session, I want them to orient. And if we thwart that, there is a lack of the cycle going up and coming down on its own, and so that's why I love, hearing about Sophie's method of working with the foals, because absolutely, it's like if someone suddenly drives you behind with a whip, you're going to go, what's that? And then if you're told not to look and go forward, you're now suddenly, your agency's gone.
Yeah.
And and so you got me just remembering a couple of things that can also happen when they've had a head trauma, and they might not have even had a rope around the neck. Birth compression, falling just naturally in the paddock, running around and just falling on their face.
Yes, exactly. I've felt a few horses where they've felt like that's happened.
Absolutely. And that will also thwart cognition. It can, they can have a foggy headed feel when we've had head trauma, pullbacks. And so it's sort of, if particularly you might get a horse that's just struggling with an orienting reflex and you haven't even started them, perhaps there's something going on there first. But I think it's the same with us. If we've had a bad experience early on, that's set in, and it might inform our later adult life, because it's done at those really core early years when myelin pathways for the cranial nerves and the visual and sensory and olfactory cortex are still being they're coming into place. So I forgot to mention, Raquel, when you said what other things could you see in a horse's behavior with a pullback, and that would be that checking in and out.
Yeah.
That foggy headedness that can happen.
Yeah, like they're not kind of staying present within their surroundings and with you. And you've probably seen that. And certainly there's been measures in human, the tentorium that forms the temporal lobes, that supports the temporal lobes of the brain. When there's been a whiplash, that angle gets changed and it affects sleep-wake cycles. So of course I start thinking, is the horse getting enough proper rest? Are we seeing my brain stopped working now. Like sleep deprivation.
That's it. Yeah. So, I mean, there's various types of it, but of course, I'm going to look at, has the horse had a head injury?
Mm.
Yeah.
Yeah. Awesome. Well, we've had lots of great discussion, and we're kind of pulling up with time. So, Emma, what would be a few takeaways that you want people to kind of leave with?
Look after your head.
Look
Look
after
after your horse's head. There'll be a lot of people like going, oh my God, you know. Yeah, sort of have it. I mean, I think both of you have just given so much great information as well in how best practice is that please don't hard tie. I really, horses do need to learn, you know, obviously, or when they're working with humans to either stand or tie or whatever. But there are ways, and I know that a webinar that Shay Stewart and I will be doing in May, she'll be talking about her methods. There's tying high up that can work very well. There are ways they can pull away. Look, and I realize that there can be a frustration with owners around that, maybe a misunderstanding. It's not behavioral. It's not natural for a horse to not be able to orient. And if they have head trauma, they're going to not want to be there. Now, I can tie my bicycle up to a post and it will stay there, okay, because it's a bike. But we need to also realize we have an animal there that is cognitive and sentient and also needs to be part of the story.
Needs to feel
Exactly, needs to feel safe, that neuroception of safety. So if I'm a big fan of certainly using soft padded halters when you are tying safely. Ground tying is fantastic, tying up high. Really don't float your horse in a rope halter. I think that's very dangerous.
Yeah, that's the one time I use a rope halter a little bit in training, but
yeah,
there's not pressure on the halter unless something bad happened. But whenever I put Ellie on the float or any of my horses, I put them in a really flat, like comfy halter, just to try to help with that.
The one thing I just wanted to touch on, obviously, is that people going to have my horse had a head injury. What do I do? Who do I get? So, you know, in humans, prolotherapy has been proven to help acute cervical syndrome like whiplash. However, it will not help the fluid flow in the brain. Vagal nerve stimulation can also help regulate some symptoms of, say, whiplash. I don't know if that's possible for horses. However, again, it's someone knowing the function of the cranium and the vascular flow importance. So that would be perhaps an SOT chiro, a cranial osteopath, a craniosacral therapist, because their training is on the bones of the head, the function of the whole system, and of course, orienting to the health, the river. That's it. I won't say any more now.
Awesome. Thank you. Sophie, would you like
you.
to highlight some of your takeaways?
I would say my biggest takeaways just then were really about your thoughts on the silent principle, how the changes in circulation, your vascular networks through the brain and also the body are so impactful because they're things you don't always see in the moment, but the fascial tension around the outside of your blood vessels especially, the effect that's going to have in so many spaces, the ability for the body to build structures, like bringing in everything from amino acids to nutrients, like it's just so important to be able to take the waste away as well. You know, for joints, bringing adequate blood flow around joints so that when they open and close, you know, they're like that pumping system for the joints, preventing arthritis. I mean, arthritis is a squillion-dollar industry,
isn't it?
Preventing arthritis would be everybody's goal if there was things you could do to help, and that's something really relevant, is good blood flow through the fascia, through the body.
Absolutely, reducing inflammation.
Yeah.
Yeah.
What about you, Raquel?
I think just the global effects of it, and how things can show up later on in life that, you know, may have happened at a much younger age, just trying to teach horses more appropriately about how to respond to pressure to try and avoid the situations where they end up having, you know, pulling into pressure. And
Mm.
I think also just the complexity and intricacy of structures around, like deep structures within the skull and that are influencing the nervous system, and how it can be difficult to discern damage in those structures. So just really thinking about that and getting your horses looked at. If you know they've had a trauma, then get them looked at. But even if you don't know they've had a trauma, it's always worth looking at that whole body function to try to optimize it, as opposed to leaving it until you have a physical or behavioral issue. So Emma, you have a webinar coming up with Shay. Would you just like to talk a little bit about that?
Thanks for letting me do a plug.
Yeah.
Yeah, I was so excited when Raquel, when you asked me to do this for you, because, you know, the thing that we can do is just talk more about it. You know, all head injuries should be taken seriously, your own and your horses.
Yeah.
And, you know, I've got literally piles of notes here, and we've only really touched 10% today. I think we could talk for ages on it. So yeah, Shay and I have done probably 3 webinars on this topic, and we got prompted to do another one. So it will be at a cheaper price. It's going to be on May the 8th, Central Time US. Time is still to be determined, and May 9th in the morning, Australia time. So that's Canberra. And it will be, you will get an email link to register, and we will obviously have pictures, probably some graphics, and we'll be talking clinical studies. And really, we're going to talk a bit about what we did today, what's happening, what are the structures underneath, what can we do
deeper.
Diving deeper.
And how can they find that? Where can they find you, and where can they find that information?
Well, just keep an eye on my page. Shay's just taking a nice vacation right now.
What's your page?
Oh, that's a good idea. I'm not very good at self-promotion, am I? Okay, so my page is Emma Loftus, Biodynamic Craniosacral for horses and humans. And I will certainly be popping up the registration link once it's up there. Shay is having a well-earned little vacation at the moment. She'll be back in about 10 days, I think. And we are putting something together on that.
Yeah, and we'll put a link. So if you can send us a link, we'll put it in with this podcast as well, and we'll put all of your details in
socials, etc.
as well. Yeah.
Thank you so much for this. It's been fun.
No, thank you.
Thank you. Yeah, just what we needed.
Yeah,
Awesome.
it's
I'm going to be re-listening to this.
Yeah, it was great.
Okay.
Yeah, lots of things to consider, and a really important.
I'm already thinking, oh, I missed this bit and that bit, but don't worry, we'll cover more in May.
Yeah, and that's the thing, like it's really a snippet. You know, we try to kind of keep it at 45 minutes, so it's quite a snippet, and there's always such a deeper level of knowledge available, and I think that's what people will realize from today, like the depth that you were talking about in terms of the skull and the structures, that, you know, often it's it's kind of a depth that's unseen, and so people don't realize that it's there. So this is an introduction, and to gain more information about the Pullbacks, go and watch Emma and Shay's webinar.
Yeah, because we'll have pictures then, so you can see what we're talking about.
Yeah, so it'll be a really great lead on from this. So yeah, thank you for joining myself, Dr. Raquel Butler, and Sophie Vanderberg, and Emma Loftus in today's podcast. Enjoy your horse time. Thanks so much, Emma, for coming and chatting to us. We really appreciate your time and everything that you do for the horses. So thank you, and all your great knowledge. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can continue to share valuable insights. And keep an eye out for our EFP course coming up in June.
And we'll see you in the next exciting episode.